So a lot of times I'll have patients, they've come to my office and they've just seen their orthopedic surgeon and they've been told, you know what, you need a knee replacement. And they'll come to me asking me, what else can I do? So we'll talk about 5 things. The first one we usually talk about is something that they may have already done, which is physical therapy. A lot of times physical therapy is overlooked or is not given enough credit, and we may try it again. And we might even add non-steroidal anti-inflammatories to it to help with the therapy. The second thing we'll usually talk about is cortisone injections. So cortisone injections actually work really well, but the problem is they only last about 3 to 4 months, and you really don't want to repeat them because repetitive injections into the joint will cause accelerated degeneration of the joint. So in the short term they may work well for you, but in the long term they're actually quite problematic for you. So the next thing we'll talk about is viscosupplementation. So viscosupplementation is where we take a gel-like substance and we inject it into the knee. And this will do a few things. It'll act like a shock absorber to the knee, it'll act like a lubricant to the knee, and it'll act like a hydraulic fluid to the knee. And generally patients do pretty well with this, and it will last usually about 6 months. The next step usually is geniculate nerve radiofrequency ablation. So this is when we actually will numb and burn the nerves around the knee. This actually works really well. It'll last almost 8 to 12 months. It'll increase the patient's function, it'll decrease their pain, and overall the patients are very happy with it. Finally, the last thing we usually talk about is PRP, or platelet-rich plasma. This usually falls under the realm of regenerative medicine, which is a big buzzword in medicine these days. The reason why I like PRP is because there is a large body of literature behind it, and much of it is encouraging. So as long as we very carefully select the patients, they can do quite well. If you have any questions or comments, please put them below. If you like what you're hearing, please click subscribe. I will see you next time.